Welcome everybody. This is the Northwest Regional Interest Groups event, Risk Management Fundamentals. With us today we have two speakers. The first is Tom Powell, who is the Head of Audit and Risk for Manchester City Council. And the second speaker will be Michael Lawrence, who is the Senior Risk Manager for Rolls-Royce. So what we'll do is if you have any questions, we can collect questions, I think, as part of this webinar. Also, after Tom's spoken, he'll have a few minutes just to answer questions after his presentation. But if you could avoid asking questions during the presentation, that would be great. Over to you, Tom.
Thanks, Alison, and good afternoon, everyone. I'm just going to step through some slides, and as Alison says, about 20 minutes, and then happy to take any questions that anyone does have. If you could bear with me on the technology, there we go. So what I plan to cover today is particularly thinking about managing risk across partnerships, and I guess I should say some of this is my personal experience working across both Manchester and Bolton Council. I'll touch on that. So a very brief introduction to me and Manchester, touch on some of the council's current risks and partnerships, very brief overview of how we approach risk management, but probably about half of the time I'll spend will be talking about health and social care partnerships, and hard not to do that within the context of the current pandemic. So Manchester City Council, figure at the top keeps going down. So when I joined, we had about 12,000 staff. Now we're down to 7,000, and it's only going in one direction. That's largely because budget-wise, we're having to make cuts along with other local authorities across the country. But overall, each year we spend about £1 billion on our revenue spend, so the cost of providing services, and also our capital investment. Particularly a big chunk of that at the moment is about redeveloping Manchester Town Hall. Serve a population in the region of around 600,000. Again, that's growing quite considerably, particularly with city centre developments. And whilst we do have some wealth in the city, particularly in the south of the conurbation, we do have some real areas of challenging deprivation. So probably one of the stats which we're least proud of, and that we put a lot of work in to try and address, is that of 326 local authority areas, last year Manchester was classed as the 6th most deprived. I guess critical for us is around our democratic process. So the city's broken into 32 wards and 96 councillors, largely a red wave, as some might describe it. There's a little bit of opposition in terms of Liberal Democrats, but largely a Labour-run council. That doesn't mean we're a homogenous body, always thinking with one mind, but that's our political makeup. And we are led by a leader and an executive of senior councillors. We're one of 10 councils in the Greater Manchester Combined Authority. So for those who aren't local to myself, that's the 10 Greater Manchester councils coming together in another local authority in which we are all represented. In terms of the council and the reason for maybe touching on partnerships, we do have a lot of history around working in partnership, and our combined authority came off the back of probably 15 years of working collaboratively across Greater Manchester, and we were able to secure one of the first areas to secure health devolution from the national NHS to support more local decision making and outcomes in Manchester. I guess for me, it's a council that always wants to look forward, wants to do things differently. It does want to take risks, and it wants to do the right things. And my role with my audit, fraud, risk hat on is to help them do that safely. Just very briefly there, I also perform the same role for Bolton Council, but today I'm going to talk largely about Manchester. Our current risk register, published to the public through our audit committee, has 6 red risks on it, and this has been recently refreshed in a kind of COVID context. And these are agreed by our senior management team and shared with our audit committee. So the detail of this goes into public meetings. We don't have a specific COVID risk because now we've taken that into reflecting its impact on other risks, and the key ones for us really are around our future financial position. We've got cuts to make before COVID came along and even bigger ones to make thereafter. We've got cost pressures arising from COVID supporting the most vulnerable, and we've also got demographic change with a population growing older and living longer, and the demand for services. So a lot of pressures from multiple angles focusing on our medium-term financial position. I won't talk through all of these because you can read them on there, but I think also worth noting that health and care integration is on there, and I'll touch on that a little bit more detail, as well as, I'm sure in common with many of yourselves, risks around the well-being, welfare, morale, capability and capacity of the workforce. We're very much at a point, as I'm sure others are, around still dealing with the response to COVID, trying to support the recovery, and trying to get back into doing some business as usual as well. In terms of partnerships, I think the presentations will be shared afterwards. If not, I'm quite happy to share the link. But again, we publish a significant partnerships register, and this goes and is discussed by our executive leaders and by our audit committee. And I guess we have partnerships at local, citywide, regional, national, and to some extent international level as well. Ironically, one of our key partners in China was Wuhan, so we've had a lot of PPE exchange. We helped them in the early days of the pandemic, and they were good enough to return the favour later on. But really, partnerships are a key part of how we deliver the vision for the city, which is set out in our Manchester strategy. I guess the partnership register itself breaks down into a range of different partnerships. So we have incorporated bodies like Manchester Airport, where we're a key shareholder, and Manchester Central, which is the convention centre in the city centre, and Manchester Life, which is a joint venture with Abu Dhabi around housing developments. We then have statutory partnerships, which we are statutorily obliged to engage in and to lead, particularly around safety and safeguarding, particularly around children and vulnerable adults. We then have, I guess, what I'd describe as non-statutory and delivery partnerships. So that's around housing. Manchester Active is our leisure partnership and supporting the delivery of both indoor and outdoor leisure facilities. And then our care partnerships, which are Manchester LCO and Manchester Health and Care Commissioning. There are, as I say, a range. I didn't write down the number actually, but there's probably about 60 or 70 currently on the partnership register, and they include both public to public, public to private, and mix of partnerships with a wide range of different entities and individuals across the city. Our approach to risk management, I'm not going to go through all the detail of how we do that, but I guess around 8 years ago when I took this over, we brought risk and business continuity together, and we do a risk and resilience strategy, risk and resilience policy, and try and do the two a little bit side by side. The strategy and policy overseen by our senior leadership team, and assurance through the audit committee, who in line with their duties look at how we're managing risk and the approach that we take and seek assurance around that. A small team, we're not immune to the cuts, so we've gone from 1 to 6 back to currently 1, but are looking to put some much more resource in around our central risk team. So obviously with a small resource, our focus is around policy, guidance and tools, and supporting really complex risk projects where we can. And that's done at 3 levels: corporate risk register, directorate level risk assessment, and then service program and project levels. I think importantly for us, we have a lot of activity-based risk management that's overseen by the professions. So safeguarding has its own risk management process. Our legal team have their own risk management process and different mechanisms of reporting, but they effectively feed up through our service directorate and ultimately corporate level. We are, as I touched on earlier, a very risk tolerant organisation. We've got a range of cultures in the organisation. As you can imagine, social care and finance are quite different cultures, and we do have that kind of difference across the organisation, which I don't see as a bad thing. I see that as a bit of a strength for us, to be honest. I guess our culture, historically heroic. We are good in a crisis, if not great in a crisis, and we've had a fair few of those to work through, to be honest. Some of this for me comes back from the Arndale bombing in the city centre a number of years ago, but we've also had severe weather events. We were probably one of the first to get really hit by the Confika virus, which took us down working off pens and paper for about 6 weeks, back in probably about 8 to 10 years ago. And obviously more recently, we've had the atrocity at the arena. And I think the council's approach with its partners is very much about supporting and responding to that crisis. And as a result, resilience is really important in our culture. It was the one thing the chief executive wanted from me on my day of arriving, was to make sure that resilience was really important. And our leader is an international champion of resilience, working with international communities and others in the wake of tsunamis and events overseas as well. So that's a really important part of our culture, to be a resilient organisation. As well as risk, I've got audit, and I think part of the culture is about doing the right thing, probably more important than doing things right. So we don't always have a compliant culture across the organisation, with very much a focus on outcomes and delivering being possibly more important than compliance, which does make it difficult when it comes to governance and assurance. This is a nod to my previous risk manager, who was very much about hearts and minds when it comes to risk management, and something I was happy to support. In terms of risk management, very much wanting to focus on outcomes and risk literacy across the organisation. He was very much more of a getting people to talk about risk is more important than writing down and having hundreds and hundreds of risk registers, and I agree with that. We want risk to be integral to people's conversations and decision making, and not seen as an add-on, and we do allow variation across the organisation. It isn't a command and control model. I don't think that would work in the current culture, so we do try and focus on what matters most and what works for individual teams. So our focus has very much been on risk literacy and risk confidence, to allow people to respond to what's coming around the corner. There are always new things, and I don't think we could have written a playbook for health and social care devolution, because nobody had done it before. We probably couldn't write a playbook for the factory, which is a £150 million arts development in the city centre, because the kind of risks involved in that, you do need people to be agile and thinking about them as they're emerging. But I do think positively, in terms of that risk literacy and confidence, means we were well placed when COVID arrived, because people weren't sat around waiting for a template or a document to fill in, but made sensible, informed, risk-based decisions on how to respond, what services to close, what to keep open, and how to support the most vulnerable across the city. Okay, in terms of partnerships, I think this was the key thing that I was asked to major on. So I really wish that the governance of our partnerships was as simple as what I've just drawn here. It really isn't. But if you just bear with me, a very brief intro into these two key partnerships. So we have two health and care partnerships, Manchester Health and Care Commissioning and Manchester Local Care Organisation. The council is represented in both of those. And on the left-hand side, we have NHS Manchester Clinical Commissioning Group. So that's the NHS body that commissions health services. So they direct the spending on health and care priorities across the city, on health priorities across the city. And they effectively commission trusts and GPs and others to deliver health services. So on the left-hand side, the Clinical Commissioning Group doesn't deliver per se, but what it does do is fund. So what we've got there is a pooled arrangements to jointly commission health and care services. So a recognition that there's no point health commissioning a load of sexual health interventions if actually the City Council, with its public health responsibility, isn't aligned with that. So the principle there is virtually pool the money, and in some cases physically, in order to commission together. Sounds obvious, but it's not done across the country. On the other side, we've actually got to deliver services, and that's where we work with a range of partners, but principally Manchester Foundation Trust. So this is a big trust that runs a variety and range of hospitals and community healthcare, and effectively some of our social care staff, or a lot of them, are seconded into a virtual organisation called the Local Care Organisation, along with midwives, district nurses and others, to deliver place-based health services. So some of that again is about joining up social care support with midwifery or district nursing, so that ultimately our residents don't end up with a revolving door of professionals coming to see them, and hopefully improves their experience and critically improves their health outcomes, reduces duplication, and fundamentally provides a better service overall. Sounds easy. If it was quite that simple, I'm sure everyone would have done it. I won't even get involved in the world of VAT and how that works across local authorities and the NHS. Suffice to say, it's been 3 years trying to sort out the VAT differences between these sectors. So critically, they are our partnerships, and they served us well and have served us well and continue to do so in response to COVID. And just a few examples that I thought bring this to life. So between local authorities and health, one of the key issues is about what we call delayed discharges of care, delayed transfers of care. So hospitals need to receive people in when they've got an acute need, and ideally turn them around and get them back out into the community as soon as possible, thus freeing up beds. That's always important, and it's always a challenge across the sector, but clearly critically so during COVID when we needed to protect beds. And whilst we did have in our International Convention Centre a Nightingale Hospital, the pressure on beds then and now remains a key issue. So we set up a joint command and control room between the hospitals and the care homes in order to streamline the process of somebody leaving a care home and going into hospital for acute treatment, and equally at the other end, as soon as they're well enough, discharging them back into the care home, into the community, or into other intermediate settings in order to try and keep beds and ICU capacity flowing. The second one I was particularly embroiled in is about PPE. We kind of saw this coming probably February time when we were starting to get involved in COVID planning and the lack of a national supply line and the risks around the corner. So in March, April time, we set up between ourselves and Trafford a mutual aid hub to procure, deliver, well, effectively procure, source, deliver, and train people in the use of personal protective equipment. And so as of last week, we were up to 8 million items, which we'd sourced and delivered, not just for our services, but critically to nursing care, home care, GPs, emergency dentistry, if you've ever had to avail yourself of those, we're supporting those, but also in terms of funeral directors and others, in order to make sure that the whole health and care system didn't fall over. Clearly, if the funeral directors can't bury people, they end up in funeral homes and you end up with a backlog. I know it sounds brutal, but you need the whole system to work. That's what we did there. And then critically, guidance and communications to residents. It's not been the easiest pandemic to do public messaging around. So really critical that we did that and set up partnerships to support the most vulnerable with food, welfare and care support. So you might think, what's the big deal? You know, just a few organisations working together, but there are massive cultural differences between the NHS and local authorities, and some of the reasons for that I just wanted to touch on. NHS, particularly in a crisis, is very command and control, directed from NHS England, and probably rightly so, because it needs to direct health resources and acute resources where they need to go. So very much a central command and control approach to the NHS, whereas for a local authority, we have locally determined priorities. We are locally directed. We serve 96 councillors and the residents of Manchester. And whilst we are accountable to central government through a variety of means, we are more accountable to our local population. So culturally, that creates a big difference of the NHS responding to national direction and us responding to local need and local communities. Statutory functions, really key. In a crisis, there's a temptation to just focus on what you have to do and your own area. And our Director of Adult Social Services has a list of statutory duties that make your eyes water. So we need to make sure that she's able to discharge them and health discharge their own. So you've got a real risk of divergence. I think health have a very active, in certain aspects, active risk management process, looking at incidents, clinical need, etc. I would probably describe the local authority as being more passive overall in terms of risk management. And again, that makes a bit of a difference in terms of cultural difference. And finally, one maybe just to touch on, when you think about the CCG, so the body that's commissioning health services, that's their single purpose. So in a partnership, their entire purpose is discharged through that partnership. For the council, it's very different. Our social care duties are discharged through that partnership, but equally, we are collecting bins, we're supporting transport, we're trying to deliver affordable housing. So a real difference in terms of purpose and roles. And so in homage to the Derry Girls, which is what the image is on there are lots of differences, but there are also reasons why it works. Because despite those differences, we're really clear on the outcomes that we need to achieve. And there is a real clear golden thread across the partnerships about supporting the vulnerable, maintaining the system, and focusing on residents and communities. It's motherhood and apple pie maybe, but relationships absolutely critical. Having the leadership co-located, having the leadership on joint boards makes it work. Not just about them though, it's actually the people at the ground level making it work as well in our integrated teams who've been working together, and that gave us a really robust basis for making sensible risk management decisions and some difficult decisions as well. And then probably under dialogue, I was thinking about kind of respect and acknowledging the respective risk appetite of the different partners. I think that's been really positive as well. And we have taken a wide range of actions that have crossed the system. So we've not thought local authority and health, we've thought health and care. And I think really probably focusing on those three, what's the end game? What's the relationships and the dialogue? As I say, it sounds obvious when I say it on here, hardly worthy of a slide, but that's what makes all the difference resolvable. And finally, just wanted to touch on lessons learned, because we've done some reviews across our teams about what have we learned from the pandemic, and thinking specifically around risk. We brought risk and resilience together as a team, but probably not as a reporting suite. So we are looking to develop more integrated risk and resilience reporting, because there's such an interaction between the two. We're looking across health and care to develop more integrated risk tools and reporting. So not just aligning our systems, but actually integrating them, particularly with community-based healthcare. And I think for me, there's an opportunity to further align our internal business continuity and our external civil resilience planning. We're pretty good at that, but there's an opportunity there. I think other things for us to probably lessons learned. I do like a RACI matrix, and I do think some of that might be useful moving forward. We've done some of that across health and care, But in terms of risk management, thinking very clearly about who's responsible and who's accountable for the risks, but who in the system just needs to know they're being managed. There is a real risk of having 4 or 5 different bodies all trying to oversee risk management, and we're going to have to take some leaps of faith with our partners in order that we allow one partnership board or entity to take that lead role in overseeing the risk management arrangements. We have been agile and flexible, and I think part of that, I'm personally thinking more than risk registers, we might want to be moving more towards situation reports. So not an incident sit rep, but a much more simplified version of reporting that enables us to do it quicker and maybe focuses on incidents, issues and risks. And then the last one, which is linked to risk management, but it's a slight tangent, is about crisis communications. We were pretty good, I think, from the outset in terms of our crisis communications, internally and externally, but definitely an opportunity to look at some of that a little bit further about how we can do that. So probably for me, the simple and agile is a really important one, and I know our political leadership are keen on seeing that explored a bit further as well. During a crisis is not the time to be writing 45-page risk management reports. We're trying to take that learning and say, well, why do we write them anyway? If we couldn't afford to do them during a crisis, why can we afford to do them generally? So key lessons learned for us are around those 4 areas. I've absolutely no idea whether I've hit the brief. Kimberly will tell me whether I have or not after the event, no doubt, but hopefully that's useful. I'm happy to take any questions this time.
Thanks, Tom. I can't see any questions in the app, but my screen keeps flashing. Anybody got any questions want to share with Tom? I've got a couple, if no one has.
Don't feel obliged.
No, I will. I will. One of the slides talks about managing risks and responding quickly to events. Do you have any kind of measure of risk tolerance? You know, what are the guardrails that allow you to know how to respond to a situation?
Probably not formally. We have done some work on kind of risk tolerance mapping across different areas. So, you know, we are very intolerant of risk when it comes to safeguarding practice. So that's not an area where we would be prepared to take risks, but we probably are more tolerant in terms of place-based services and what we might do there, or even some of our investments. So we did do a piece of work, probably looking across 10 or 12 kind of areas, just to give that almost framework really for decision making, and to reiterate that where the areas where officers are more permitted to take a bit more risk, but critically also with that, when they take that risk, what do they need to do about it? There was a project a couple of years ago, which I probably can't mention at this point, but something that was done outside of kind of initial public scrutiny because of the nature of it. And within that, there were a series of pretty big financial risks that we were going to take. But the upside and the opportunity was so great. It was effectively one of those decisions where there's a 60% chance that it won't work and a 40% chance that it would work. But if it did work, by God, it was a game changer. So for me, the key thing was supporting the team and the leadership around articulating those risks. So when we took the decision, everyone understood this was not a banker that was definitely going to come off. There's a good chance we could lose money, but actually, if it went the other way, there would be a massive improvement in outcomes for residents. I don't know if that's just fluff to avoid answering your question, Alison, but it's an answer of sorts.
Thank you. And the other question I had was, you talked about situation reports potentially replacing risk registers, and I guess that would work where a risk becomes an issue, where things materialise. What about things that haven't happened yet? things on the horizon, how would you capture those risks?
I think possibly SITREP is probably the wrong word. There's a lot of discussion of SITREPs in the council at the moment, and they're probably not describing SITREPs. They're just describing a much more simplified way of reporting and recording risk. So rather than the landscape kind of spreadsheet of risks, let's find a different way to start reporting on those in a more simplified way, because it absolutely does have to pick up the horizontal type stuff. You know, we are seeing some impacts of climate change at the moment, but actually the further horizontal risks around that are far greater. So it's not just a focus on issues, it would definitely be about simplifying and having a more agile approach to reporting risk. They just like to use the word SITREP at the moment. Right. I'm not entirely sure that it's the right terminology.
No, but that makes a lot of sense. Thanks a lot, Tom. I can't see any questions in the menu. And bear in mind it's 32 past. I was going to hand over to Michael, if that's okay with you, Tom. And if you have time at the end for any questions for you, I'm sure we can go back to you if that's all right. Are you happy to hang around?
Yeah, absolutely. I'll have to do Michael's slides.
Awesome. Thanks a lot, Tom. Michael, over to you, please.
Thank you very much. Thank you, Alison. Thank you, Tom, for delivering such an excellent presentation. Tom, just before I start, because I can see you on camera, can I just have a thumbs up that you can hear me, that I'm coming through loud and clear? Brilliant, brilliant. Okay, and also a big thanks to Tom, because I haven't been able to make the technology work my end. So Tom has very, very kindly volunteered to be my driver for this this little jaunt I'm about to take you through. So Tom, really appreciate it. Thank you again. Okay, so ladies and gentlemen, good afternoon. Let me very, very quickly introduce myself. So my name is Mike Lawrence. I'm going to talk to you this afternoon about risk fundamentals. I work in the enterprise risk team at Rolls-Royce, and I'm going to be taking you through this afternoon some of the things that we do in Rolls-Royce around risk fundamentals. Tom, if I could have the next slide, please. So very, very quickly, just in terms of my structure, I'm going to give you a quick overview of Rolls-Royce, who we are, what we do, and possibly, quite importantly, who we're not and what we don't do. So that will be the first part. I'll cover that quite quickly. I'm then going to move on and talk about our risk framework. So how do we intend to do risk management in Rolls-Royce? And then the bulk of my chat this afternoon to you is all about effective risk management. So how in Rolls-Royce do we identify and assess whether we're doing effective risk management? Hopefully that should take 20 minutes or less, and I will pause at the end to take any questions that you have. So without further ado, I'm going to move on. If you could move me on to the next one as well, please, Tom, that'd be great. Brilliant. So who are Rolls-Royce and what do we do? Our vision, as it says on this slide in front of you, is that we will pioneer the power that matters. So focus on delivering the world's power needs both today and tomorrow. If you move me on again, please, Tom. What does that mean in practice? Well, what it means is we believe that we have the skills, particularly sort of in developing new technology, that can help the world meet its needs for an increasing amount of cleaner, sustainable power to power the things that we all come to depend on in the world. So that's really what we do and how we do it and what our vision is. And the way we do that, if you could move me on to the next slide again, please, Tom, is through what we call our 3 business units. And those business units operate in 3 separate but sometimes overlapping markets. Firstly, civil aerospace, which is our biggest business unit, particularly by employees and turnover, who typically make engines for civil aircraft and also for private jets. We have a power systems business, which make reciprocating engines. And those engines go into all manner of applications from boats to ferries to yachts to tanks to large construction equipment, and everything through to things like backup power for data centers, which I know Alison's Amazon company will be quite reliant on. And last but by no means least, we also have a defence business. So principal products for them are again engines that power transport and combat aircraft. But we also make other products for our defence customers, not least engines for nuclear submarines. So that's sort of a flavour of some of the products we make and some of the markets we operate in. And Tom, if you would move me on once more, and hopefully for those of you who have just been paying attention, you'll recognise that the one key omission is we don't make the cars. They are now made by another company. So yes, gags about my company car later, please. I've heard most of them before, but yes, unfortunately, we don't make motor cars like that at the moment. Okay, let's move on, please, Tom. Thank you. If I could have the next one as well. So that's an overview of who we are, what we do, and the markets we operate in. Let me move on now to risk management and how we do risk management. So we have something called a governance framework, which sets out how all parts of the group work. And within that governance framework, we describe our approach to risk management, which I'll come on and talk about in a moment. Before I do that, let me just pause and maybe come back and say, one of the things that we're a UK listed company on the stock market. And so that means that we have to comply with the UK Code of Corporate Governance. Many of you will probably know and probably be in a similar boat, but what that means in terms of some of the things that we're required to do through those rules is that we need to identify principal risks that prevent the group achieving its strategy, vision, and financial objectives. We also need to identify emerging risks, which is something that Alison was asking Tom about a moment ago. We need to assess the viability of the company based on things like the principal risks were they to happen. So put another way, do we run out of money if one or more of our principal risks happen? And last but by no means least, and this is the thing I'm going to focus on most heavily through my presentation today, we review or we're required to review the effectiveness of our risk management and internal control system. So let's just step through what our risk management system entails. It entails what many of you will be familiar with, which is risk management. So identifying and assessing risks to the business. If you can move on again, please, Tom. It also looks at internal controls. So what are those measures that are designed and deployed to manage and mitigate those risks down to an acceptable level? And we'll talk about what that acceptable level is in a moment. And finally, it also requires that we put in place some assurance. So who's checking, who has got a degree of independence in particular, is checking that those controls really are effective and the risks really are mitigated down to that acceptable level in practice. So we call that's all nested within what we call our governance framework, and we call that our risk control and assurance framework. And when I say risk management, I'm largely talking about all three of those things. We bring that to life through the group's risk management framework, which is the rather busy slide that you can see in front of you. What I'd like to draw out, though, rather than talking you through all of those bits, is some of the key parts on there. So towards the left-hand side, there is our governance structure. The important part, I think, there for me is that the group's principal risks are ultimately owned by the main board of directors. And that helps us get that tone from the top that many of you will hear about and find, I'm sure will find very important in your own organisations. But the actual day-to-day management of many of those big risks is delegated to risk owners across the business and those operating businesses that I talked about a few moments ago. And I'm going to come on and talk a bit more in a few moments about that ownership and that accountability. Other things just to call out again on the left-hand side is that we look to capture, report and learn from incidents. And that's certainly a very important part of our risk management approach, to make sure that we truly are learning from those things. And we're also sharing it across the wider group. So if an incident happens in one part, we're not limiting the learning to that part of the business where it happens, but we're sharing it more widely across the group as a whole, so that the whole group benefits. If I now jump all the way over to the right-hand side, we have, which again I think was one of Alison's questions to Tom, we have at a group level set what we call our risk appetite, or that level of risk that we're prepared to accept, and that gives those guide rails, or those that guidance for parts of the business as to what an acceptable level of risk is, as defined by the board. And the other thing which I'm going to come on and talk about in a moment is about our definition of effectiveness, or as a previous boss of mine would have said, what does good look like? So what does good risk management look like? How do we answer that question? Have we got an effective system of risk management in place? Tom, if you could move me on again, please. The bit I didn't cover on that previous slide, but I think the bit that was at the bottom of it and that really underpins and underscores all of it is people. Tom talked very eloquently about the importance of people in his presentation, and I'm not going to do as good a job of this as Tom did, I suspect. But for me, risk management is all about people, and it's all about what people do and how they do it, and that really is the glue and the engine that makes those previous two slides that I've shared, those frameworks, come to life and actually add value to Rolls-Royce and how it operates. And key amongst that, we're increasingly finding is that risk owners take and demonstrate ownership and accountability for managing those risks effectively, and that's something that we've certainly put as one of the central tenets of our approach to drive effective risk management in Rolls-Royce. So yeah, people at the front and centre of driving this is really, really important. Tom, if you would move me on again at 2. So we're into the meat of what I really want to talk to you about this afternoon. Tom's doing a great job making the presentation work, so thank you, Tom, and I hope the technology continues to bear with us for this last bit. There's a quote in front of you, hopefully you can all see it, which is by a guy called Tony Robbins, who many of you will have heard of. Tony Robbins is a coach to the rich, famous and successful. And I thought this quote was quite instructive in terms of what I'm about to go through with you in a few moments. Questions, and in particular asking the right questions, is a really powerful tool. And we've tried to harness this power in our approach to helping us to understand whether or not we're managing risk effectively. So as I go through, what I'm now going to cover with you is what in Rolls-Royce we call our 8 questions to understand whether or not we're managing risk effectively. So Tom, again, if you could move me on, thank you. So if you just go, yeah, thank you. Just go back at 1. Brilliant. So these 8 questions, as hopefully you'll appreciate, really come from what I've already shared with you. So they come from the risk framework and our risk and control and assurance approach at group level, and they look to understand whether that is in place and operating properly across the group. So I've divided these 8 questions into 4 key areas. The first one being risk, the second one being control, the third one being assurance, and the final one being some of the other bits that we mentioned a few moments ago: incidents, appetite, and communication. So if we start with the first 3 questions, which all relate to risk, and they are, have we actually clearly described the risk? is the risk owned, and do the right people feel ownership for the risk? And have we quantified the risk? So if we unpack those very quickly, what are we looking for there? For the risk description, we follow what many of you will know is either a bow tie model or a cause event effect model. And we look to try and make sure that people have clearly articulated what all of the causes of the risk are, so that we can then ensure that our subsequent treatment and mitigations are comprehensive for the risk that we are facing. Risk ownership, we try and ensure, again, and this is back to the point about accountability and risk owners taking accountability, we try and ensure that the risk owner is the person who will ultimately feel the pain of the risk if it were to happen. And we look to try and make sure that the risk owner is the person who is answering these 8 questions about whether the risk is managed effectively. So that's what we're looking for there, that they're clear. We're clear on who the owner is, and the owner is the person who's going to feel the pain if the risk is going to happen. And the final part of that risk element then is, has the risk been quantified? So have we got that assessment of the current level of risk, the target level of risk, or current and or gross and net, for example, and have we actually linked that assessment back to some of those underlying plans and forecasts, particularly our financial plans and forecasts that we have in the business? So very much like Tom said in his presentation, are we making sure that some of these risk bits of information are built into what we do as part of our business and not bolted on, and that they're flowing from our existing risk processes and information? Tom, if you could move me on again, please. Question 4 of the 8 is all about controls, and in particular, looking to understand whether our controls are complete. So do they actually address all of the root causes that we've identified? Are they comprehensive? So do they operate everywhere across the group that we need them to operate? Do they relate to the risk? And very importantly, are they actually effective? So are they both designed effectively and operating effectively to manage and mitigate the risk? So that's our control question. Tom, if you could move me on again one more, thank you. The next question then that we're asking is, what assurance do we have? Or put a slightly different way, who's marking the homework? So question 4 on control effectiveness is typically done by the control owner. In Rolls-Royce, we operate what we call a 3 lines of defense model, which I'm sure many of you will be very familiar with. So question 5 is really asking which of the second and third line are overseeing this risk? Have we got appropriate oversight from those additional lines of assurance? And also looking there to understand what their conclusions about whether the control effectiveness is, and whether they are in agreement with or disagree with the first line's assessment. So that's what the 5th question is looking to try and answer. And then Tom, if you would do the last reveal, please. So questions 6, 7, and 8 relate to those other parts. So question 6, firstly, have we captured incidents, and are we using them to improve some of the prior questions? In particular, are we using them to update and inform our assessment of the risk? And are we also using it to improve the quality and the coverage of our control environment? So using those things to make us better and stronger. I'm going to skip question 7 for a minute. I'm going to go on to question 8. And question 8 is all about, again, I think it was Alison and Tom who talked about it, all about communication. So have we communicated our findings and our answers to the right people in the right way? And again, as many of you I'm sure will have in place, we have a delegated authority framework or a decision rights framework, as we call it in Rolls-Royce. So again, this is really asking, are the right people aware of the risk? Are they aware of the level of risk that we're taking? and are they aware of how effectively that is being managed? And again, back to one of my prior slides, that communication goes up to and includes the main board of directors for Rolls-Royce Group, and informing them of the risks that we face and how well they're managed. And last but by no means least, and this sort of is the first among equals of those 8 questions for me, is are we operating within our risk appetite? Or put another way, are we getting an appropriate level of reward for the risks that we're taking? And if we are operating out of appetite, have we got clear, concrete, defined plans to get us back into appetite within a timely manner? That's what that's really getting at, or trying to assess. And again, much like Tom said, we have a variety of different risks that we take across Rolls-Royce. So we don't have a uniform appetite. Our appetite for different risks is different. And we are very, very aware that we need to take risks to generate rewards as a commercial entity. But it's about taking the right level of risk and getting the right level of reward, and that really is what that question is trying to get at. I'm almost done. Hopefully as well on time. But before I close, again, Tom talked brilliantly about COVID and the way how that's impacted Manchester and what they've done about it. I guess for us in this framework, COVID is question 6. It's an incident to which we've had to respond. And so just to prove to you that we're living and breathing this, because of that, we have actually done a group-wide review of COVID, and we've used that to look at some of the things that question 6 asks. Did we get some of the quantification of our existing risks right? Were our controls working? And using that to look at both reassessing and re-quantifying some of our existing risks, and looking at the effectiveness of the controls and where they need to be strengthened. So yeah, just to say we are putting that into practice. I guess back to my headline point just before I finish. As I said, we are asking risk owners to answer these 8 questions, and that for me is all about that really important point of getting them to demonstrate that ownership and getting them to take accountability. And in doing so, getting them to bring that risk management system and that risk framework in Rolls-Royce to life. That was all I wanted to share with you today. I'm happy to come back in future, Alison, if you would like, and touch on some of the other things that we do in Rolls-Royce, if you would like me to. But I'm going to finish there for today. I think we've got a few minutes. So Tom, if you'd move me on one, I'm going to pause in case there are any questions.
That's awesome. Thank you so much, Michael. We have a question. I'll read it out to you. It's both Tom and Michael. Firstly, thank you for the presentations. In terms of your approaches to risk management, do you operate a single and fully integrated system? And if so, what system do you use? Or do you find you manage a number of different systems supported by the appropriate framework? Should we go to Tom first, please?
Not on your Nelly do we have a single framework. I'm not even sure we've got one framework within the same services sometimes. No, we operate very much a distributed model. So we pull things together, and we've just moved to Microsoft, so we are going to think about how we use some kind of SharePoint tools around this. But we do have different ways of recording and not a single system. We are looking at the moment, and I kind of touched on it in tangent in my presentation, where there is a tool that's used across the Foundation Trust, and we are thinking about applying that across all of our health and care areas. So at least within that system, there's a single approach. But no, not a single system at the moment, unless somebody's got a really cheap version that works really well that they can pitch me. I'm always open to such offers.
Thanks, Tom. Michael, to you.
So without sounding too much like a politician, Alison, yes and no. So in terms of the framework question, if I take that first, yes, the framework that I shared, that risk control and assurance, is common across the group. and that sits in what we call our governance framework, which applies group wide. So those principles and that approach are common and apply across all of Rolls-Royce, all of our different businesses, countries, etc., etc., etc. In terms of answering the question that Tom also answered, the tool set, no, we don't have a common tool set. And I suspect, like many people on the call, we do have some risk database tools that people can use. More often than not, people will default to things like Excel for recording risks.
Thank you. Any other questions for Tom or Michael? I've got a hand. I can't see who's put the hand up. If you put your hand up, if you wouldn't mind unmuting yourself if possible, asking the question, that'd be great.
Alison, if technology is going to let us down, I'm happy to take questions offline and come back to people. If the IRM can collect them, I'm more than happy to do that.
Sure, because my system is so slow, I can't see who's raised their hand. I'll have a quick look now. If you could put it in the chat, that'd be great. Yeah, I can't see it. Okay, I was going to ask you a quick one, Michael. In terms of, I mean, you talked to us about the framework you have in place and how you manage risk across Rolls-Royce, which is, absolutely perfectly the brief. What would you say your top, say, 3 risks are at the moment? What worries you the most?
So it's a really good question, Alison, and we actually did this exercise at half year. So let me answer it. Let me answer you the question of what would have worried me at half year. Let me answer you the question is what do I think is the key risk for Rolls-Royce in the next 12 months, and then maybe if I can be that cheeky, let me tell you what I think the major risk for Rolls-Royce over the next sort of decade or couple of decades is, maybe just to sort of talk about those emerging risks that you asked Tom about. So if you would have asked me at half year, I would have said to you the major risk for Rolls-Royce is an existential one, and it's that we run out of money. A large proportion of our sales go to airlines. We're very, very dependent on aeroplanes flying. We make a lot of our money. We call it power by the hour, but essentially we make revenue every time an aeroplane engine flies, turns and burns, as the people in the aerospace business would call it. And COVID has had such a dramatic effect on stopping air travel that our revenues went from being quite healthy in January and February to being almost non-existent in April and May. And we actually, for those of you who follow Rolls-Royce, we did actually qualify our going concern statement at the half year. So the big risk at half year, Alison, was all about liquidity. We've since done an awful lot of really, really good things. Now, guys in Treasury have been heavily involved in that, but including things like securing funding from the UK government through some of their debt schemes. We've also gone onto the bond markets and got additional funds, and we're in the process of a rights issue with our shareholders, all of which are basically just designed to strengthen our balance sheet and to give us that liquidity we need to survive. So that would have been the big one for me if you'd have asked me 2, 3, 4 months ago. Going forward, I guess the two big risks that I see are when and to what extent the civil aerospace market picks back up. That's going to be critical to our financial health in the near term, and also our ability to deliver on some of our restructuring activities that we have committed to doing. So actually driving that amount of change through our business, doing things differently. Tom used the word, I think, agile. That will be critical to us. If I look at sort of the slightly longer term, I think as and hopefully when our markets recover, the health of our supply chain will be a key risk for us. A lot of our supply chain has shut down, and hopefully they're going to be resilient and be around when we need them when the market starts to recover. Although that's by no means certain. And I think if I were to give you that emerging risk that I know you asked Tom for, I think the big 10 to 20 year risk for Rolls-Royce is all about climate change, and it's all about re-engineering our products so they no longer burn fossil fuels and start and use more sustainable sources of power. So they would be the 3 or 4 that I guess I would point you to. I hope that answered your question.
It does. Thank you so much. Just conscious that it's just gone 1 o'clock. I could see in the pane there were people who had questions, but I can't see the questions within the area, which is odd. So I will speak to the IOM to find out why that is. And so if we can collate your questions and direct them to Tom or Michael, we will do and get back to you. So I will ask the IOM to write out to you to collect any questions that you have. Thanks so much for everyone's time. Thanks again, Tom, Michael, really appreciate your presentations, the time you've taken out and your insights. Thank you very much.
That's a pleasure. Tom, thanks for driving as well.
Thank you, Tom, it was a lifesaver. Thanks a lot.
Thank you.
Okay.
Thanks.
Bye-bye.
Thanks, bye.